Thank you so much, Sumit sir, for joining us on a podcast with Dawdle. We are extremely grateful to you that you took out time to share your experiences, your insights with our global audience. You have a prolific profile. And but before we go to the set of topics that we have where we want your insights on, if you could take us to your journey so far to give a bit of context to our audience.
Absolutely. And thank you for having me also today, Rishikesh. Last 15 years, I've called India my home because I returned back from US. I was there prior to that, in United States where I had gone for my higher studies. And over there, primarily, I was in the financial sector. But I returned, it just so happened, by chance that, I ended up in the healthcare domain. I started my healthcare journey in Mumbai, and Mumbai being the financial capital, and I coming from financial sector, a lot of my friends ask me, how come you are in changing gears, so to speak? Primarily, I would just simply say that it was an opportunity for me to learn something new, which was very, very different from what I had done before. And I also thought that, where financial sector is quite well endowed in how they conduct their business, IT operations, everything else. Healthcare, at least in Indian context, is a little behind the curve. And that's when I started. It's been roughly about 15 years. I still think, I'm continuing to learn in this space. My journey started as the group CIO, for a Mumbai-based large, institution which had multiple units locations. It took me, after having spent some substantial time there, to Abu Dhabi, where again I was the group CIO of a hospital chain. In fact, they had more than hospitals. They had some manufacturing related to healthcare too, and clinics and etc. in 4 different countries. I was there for roughly 3 years, actually 3 years there. It also was the COVID time then. And thereafter, about 3 years ago, I returned back to India, and I wanted to do something else. I could have done what I was doing at the that level, quite easily. But I thought that the kind of resources, people that maybe mid tier hospitals or even the smaller institutions can is a little bit difficult to get them quality resources. And so I started this company, Timer Solutions, which is primarily into healthcare advisory as well as execution field. And I have incubated it in a bootstrap manner since then, and we've been fairly successful with some good clients of repute. Today, here we are sitting across and talking on subjects like this. Yeah.
Prolific journey, sir. And since you have been into healthcare, our first topic is around healthcare itself, where we talk about hospital information systems and electronic medical records, which are at the core of healthcare IT.
Yeah.
In your views, what are the biggest challenges that organizations face in implementing them successfully?
You see, I mean, what I would tell you that the biggest challenge is adoption. Primarily because if you look at the hospitals specifically in the Indian context, I would just simply put it, or in the subcontinent also, the patient volumes are immense, and the patient volume flows are quite high, and adoption becomes a challenge when the clinicians, clinical staff, or even administrators find the workflows in the HMI system not in tune with what they are used to. They may be lifted and shifted from the Western ways of doing things. So then there is the adoption challenge, obviously, as I said. The second thing is the cost of the HIS systems themselves. Hospitals, care organizations, by and large, are low margin operations. So they don't have very high margins, very competitive landscape. So, while digital transformation, digital adoption is highly desirable, in all segments, in all regions of the country, tier 1, tier 2, tier 3 cities. They find it, a little challenging, to meet the upfront costs that may come about. With these kind of HIS systems, EMR systems. EMR systems are also, if you look at it, are not very interoperable. Then the data is locked up a little bit, within each EMR or EHR, if you want to call it EMR only. And so that's another thing wherein I think that's a challenging thing. And last but not the least, change management, no matter which industry, which place, is always a difficult thing. People are used to, the way they do. And so, you need to create a coalition of the willing, which will show the way forward. It's like Carter has 8 steps, so to speak, right? You need to go through that process. The change champions need to be there, you have to invest in training and staffing. If you do that, upfront, then perhaps you will have a overall better, change and adoption and everything else. So these probably.
This is very insightful, sir. You have explained it so well, and this is very nicely explained, I would say. And the next topic is around telemedicine and remote monitoring, which are now becoming very mainstream, especially after the pandemic. You see all
Yeah.
these remote ICUs concepts also coming up. So,
Yes.
so how do you see their role evolving in delivering accessible and cost-effective care?
Certainly. See, post the COVID pandemic, I mean, telemedicine had existed, but it was not really getting adopted too much because, the traditional way of sitting across the desk and meeting a clinician, physician, care provider was the way. But I think COVID, broke that, myth, so to speak. People have become far more, open and, accepting it, of course, more on the urban areas, if I may put it that way. Still a little bit challenging, in the tier 2, tier 3 cities, but I think the acceptance is far more. At the onset, if you recall, when COVID was there, these, telemedicine solutions, were mostly standalone applications. Maybe there's an app, you do a video call, and through the video call, you get certain, details back and forth between the patient and the doctor and so on, but I think now it's going to evolve wherein, it'll become part of the main, core systems of the hospitals itself. It won't be a standalone thing. It'll be well coupled and integrated with the core systems, let's say the EMR, EHR, or HIS systems. The big advantage, of course, is that all of the data for the patient is fully integrated. It's just simply that, just sitting instead of across the, across the table, wherever you may be. And so that's one thing that I think very important change that's upcoming. Today, we have, a lot of wearables, connected devices, and, mobility solutions of other kind that are now basically becoming the ecosystem of, remote patient monitoring. So, I mean, the use case of, let us say, in a small, rural area, one can reach quite easily, collect all the data that may be there, at the patient bedside, and you can get all the data, coming up to somebody, a clinician, of repute, maybe at a very, prestigious institution, and the continuity of care becomes far more easier. So
Yes.
if you can imagine, like, there's a huge, diabetic, population, which probably is not yet, diagnosed, or maybe people with, hypertension, you know, their continuity of care will not suffer due to distance, let us just simply say. Post operative care also, you see, people still travel to urban centers for their, kind of surgery or intervention they may need, but they go return back to their hometown now. So the continuity of care will become far better as such, with the remote patient monitoring systems that are evolving, and the reach and the scale will become far better, with these applications
Right.
coming up.
And also, sir, from the Indian context, it's kind of a lot of hospital leaders also tell that post-visit experiences are still not up to the mark, like, the follow-ups when the patient comes out of the hospital. And there are a lot of digital engagement tools which are coming up, to promise better pre and post-visit experience. What do you believe are the main features or innovation that will truly move the needle for patients?
Uh, you see, today, if you look at it, we are used to ordering, groceries, food, whatever it may be, online, and it is so simple now, and so the adoption has increased. Likewise, the expectation in healthcare also is that the if I may call it, the friction, so to speak, between what, what one, a patient desires to how it is getting delivered will also need to change. So, you know, they need to have a very seamless experience in choosing the facility, choosing the doctor, you know, booking their own appointment slots, and then, obviously, making digital, making payments. And then maybe when they come in, they can check in also digitally as such, they want it a very seamless experience, like they're having in other areas as well. So that's, I think, very important with these particular innovations, changes. I think what we could get is, like I said previously also, the continuity of care will be far better, and even post-op care will be far better. So these digital interventions are going to be far more coming and making it easier for our patient population. you know I feel today also it's happening, and much more to come.
Yes. So just out of the box, I was thinking that since you have been in the US, and US
Yes.
has a very connected healthcare system. So, you know, unlike India, where every healthcare system is like kind of divided. Like Apollo operates differently, Medanta operates differently, every
Yes.
hospital different. Do you think this is also one challenge why a continuity of the patient journey is not being maintained?
A little bit for sure. And yes, you are right. I mean, the continuity of care, maybe, if you want to say the EHR context is getting better in the West, but, even in India, that is already happening. If you look at it, the ABDM that is basically there, in India, it actually is aiming for that itself, wherein, no matter, where, which institution, which, healthcare center you go, your, clinical profile, clinical data basically would go along with you. Clinical data is a very personal data as such,
Yes.
and it should be, the kind of way that, it is accessed also, it needs to be controlled. And so I think regulation is coming in this space also with the DPT, which is being, in the works for quite maybe a year or two, and we could see some changes. So healthcare information exchange, in its in a different way is coming to India too. Yes, you are right. In West, and maybe even nearer also, let's say in Middle East and Gulf countries also it is there. The key advantage is like, patient data is moving one unit to another, to another. And so a new clinician can actually see past history much better. So, tests, reports, whatever may be, that you might have already done it, you may not have to repeat it again. So, it will be little bit of cost savings will definitely come with that. And like I said, the ABDM, that our thing, all that the government is trying to push, is actually in some sense that itself, and the needle is moving in the right direction.
Yeah.
But we have to be, we are a 1.4 billion
Yes.
people country.
Correct.
So we have to be a little more patient. We cannot do it like maybe a small nation that can do very quickly.
Absolutely, sir. And that coming to one of your favorite, topics is related to analytics and decision support across industries, which you have
Yes.
championed across various industries. How do you see data and BI tools transforming healthcare delivery and hospital operations?
You see, if you look at hospital or many other industries, financial also, it is like that. There are multiple, applications at play. Obviously, we talked about the HIS system, but very likely there will be an ERP system. There may be SAP, Oracle, Tally, whatever it may be. There may be, HRMS systems as well. And then even besides this, there could be lab information system, there could be PACS. So what I'm trying to tell you is that data is in silos. Okay,
Yes.
bits and pieces of data are there everywhere. And so if you look at it, at one particular data source, then you may get only one part of the story. You need to basically have them connected together, like, to give you a wholesome picture. I mean, if I was the CEO of a hospital, for example, I want to see far more than just say, let us say, occupancy. I may want to actually know lot more in terms of such that I can basically plan out my operations far better, like what my revenues could be, where the occupancies are going to be different because of seasonality, because of certain outbreaks of whatever it may be, so on and so forth. So the biggest thing that is there to stitch the data together. If you get the data together, then what surfacing out through business intelligence platform is not that hard. You have to be able to ask the right questions, and then when you ask the right questions, it can be surfaced through these applications quite well. So I would just simply say that for getting actionable intelligence, what one must do is look at connecting the data together. Of course, we also still have the case where a lot of data is still on paper.
Yes.
That has to be changing. And if you don't have adoption of the systems, then there is no data, even though the application is there. So these things are there, the challenges. But if you do it right and in a consistent manner, I think one can get a lot of good, insightful this thing, information. I mean, what the CEO wants, maybe what the operational team wants are two different things. Hey, they may want to, plan for staffing based upon what the outcomes are. They may want to look at, follow-ups, repeats. There are so many things that can be done, but you must have a wholesome, data source for this. Work on that.
So on top of these data sources, there's a very relevant topic which is there, and you have led enterprise machine learning platforms in your past. What's your perspective on how AI ML can reduce the cost and complexity in scaling healthcare or even financial services use cases?
Yeah. See, what AI can do for us is basically, help us in scaling our our institution's output without actually, putting in more, resources. If we look at the back office operations, which may be claim processing, which may be appointment scheduling, which may be, RCM, so many things are there, right? They are very people driven, right? So then, if you can, make it, and they're quite repetitive also, quite frankly. There are quite a few set of rules that can do. So AI can come and free up resources to do, which basically requires a human judgment, wisdom, that decision making, the extra bit that probably we cannot expect AI to do today. So, the AI's, biggest role with there, if imagine, like, I mean, today we talk about it. Also, it's there probably happening some places. The X-rays could be, studied very well. The scans could be studied very well by these, AI engines. And so they can basically, with great amount of certainty tell what to look for and what can be ignored and so on and so forth, right? Then that frees up the consultant, the doctor to, not do such things, mundane stuff, but do actually core stuff. So what has happened is with AI, you can scale up your operations without, additional huge amount of manpower. It may be you may be able to use it better. Likewise, in machine learning, unfortunately, there are frauds
Yes.
that happens. So it can help in fraud detection,
Yes.
compliance. Maybe there are regulatory things that is also there. So these are the areas I think AI and ML have, a lot of things that can be done, across the globe in India.
And so relating to that, so also like if you see the healthcare or hospitals in India, as you were mentioning in the beginning, they may not have the right talent available in house,
Yeah.
many a times to implement all these things. And that's why they're always in kind of doubts, like whether this thing will work or not. And where do you see the role of experts like you or people, who have been into the industry, for such a long time can help these hospitals, kind of get that confidence of implementing these AI ML platforms and get right use cases out of them?
You see, you, AI is also having a lot of marketing buzz.
Yes,
Okay,
yes,
and everything AI will not solve,
yes,
right? Or there's a lot of promise which is ahead. I mean, we have been into this. One can say it's been a long journey, but it is not a long journey, in my opinion. We are just beginning to get the compute power necessary for AI only recently, and maybe more so in the West, where affordability and accessibility to such, tools and technologies slightly more. And so, it should not be something that, what we read so much, becomes so that, it can happen today. One has to be a little bit more pragmatic. The role of people like us is to bring that pragmatism into play, and get some good early successes. There would be some low hanging fruits, in this space also,
yes,
that actually will deliver a lot of good. And so, I would start by advising that, look out for what is your problem first, and don't go for what is basically, you are just dazzled about.
yes,
Look
absolutely.
at your problems, and then, are there low hanging, fruit kind of solutions that AI can offer, and go for it, and go in a methodical manner. Because the more we read the possibility of AI, likewise we are reading also some of the failure stories too, where it didn't work out.
Yes.
You don't want to be part of that crowd, so to speak. So experts like myself and others, like, as you said, we can bring that realism back to the table, and make probably that happen.
Yeah, absolutely. That's the need of the day, sir, because I see, hospitals, they want to implement, but they are skeptical, like, how
Yeah.
to go. And then there are a lot of buzzwords, product pushes all around.
Yes, yes. So, or they've always been there. I mean, it's always a cycle. Something is buzzing all the time. So one has to be a little bit more, and we would help in that. I mean, we will work out the ROIs, and then ensure that it happens, and then so on.
So related to this only, there is always a thing called cybersecurity which comes into the picture when we talk about data. And from your experience, so cybersecurity, especially in healthcare and finance, what are the unique risks which are there in these sectors, and how should organizations address them without slowing down their digital transformation journey?
Okay. See, I mean, what are the two most critical things, that one, cares about, right? One's own money, so to speak, if I may put it, and their own health records. These
Yes.
are the one or two most critical things where, that we have, so to speak, as a population, as a civilization itself, right? And so it becomes a very attractive target for cyber criminals, and so they are always obviously basically looking to exploit us. Exploit for these type of stuffs. And in the current situation in healthcare, the investment or awareness of these are slightly low.
Hmm.
Risks are very high.
Yes.
See, ransomware can take out, the entire hospital's, operations out. It has happened in the West. Forget about in our country. And when they do that, lives are at stake. I mean, imagine, ICU patients that are admitted, right, in the hospital. Now your entire system is down because of the ransomware attack, right? I mean, so the risks are extremely high. And likewise, if you look at it, I mean, that has again happened in financial institutions also. Our life savings are there. Based on that, we plan our, future as such. Your kids, your family, your retirement, anything. And so these things need a lot of attention. And it's a cat and mouse game.
Hmm.
One cannot take your eyes off on this.
Hmm.
This one of the thing is that the digital transformation and cybersecurity is sometimes thought of as contrary to each other, in
Yes.
the sense that you put cybersecurity measures, your digital transformation may suffer. That probably is the case if it is an afterthought,
Hmm.
rather than planned from the beginning.
Hmm.
If it is, if it can be planned from the beginning, it is not a bolt on, it's built in, then obviously you will not have that. Okay. And so, I mean, this is an area that, I think hospitals and healthcare, as well as financial institutions, must, continue to be on top of it. It's not, one and done and then relax about it. It's, as I said, a cat and mouse stuff. You need to keep yourself updated with what's out there, and then protect your environment, any which way possible.
So
Yeah.
these days, a lot of low code, no code tools are coming up.
Yeah.
And so how do you see them, as accelerators of innovation or as tools that are creating new governance risks?
No, I am very excited about it. I have, I mean, I was maybe a teenager when I first got into coding myself. I
Yes.
loved it. And I still like to write some today too, time permitting. I want to try certain things myself before I talk about it. So I am very much, what do you call that, for them as
Mm.
such. It democratizes the coding processes,
Yes.
so to speak.
Mm.
But, and so imagine like, doctors, you know, nursing team or financial managers, whatever, whoever, right? They can also learn low code and no code and develop applications.
Mm.
Okay. And it can do a few things that they may be basically, facing.
Mm.
Sometimes, we technologists take months to do the same thing because whatever, maybe too many work on our hand, too many other priorities, whatever may be the situation. But a proliferation of these kind of, if I may say, practices can have, unwanted consequences. I mean, there could be, data leaks.
Yes.
There could be cybersecurity flaws. They could create a shadow IT themselves, so on and so forth. Okay. The governance piece can actually be lost in that process. And so there has to be a happy middle ground, in my opinion, wherein, wherein, a certain empowerment has to be given to, folks who want to do it. It's not that everybody wants to do it. There will be only a few who are too excited and, they
Yes.
they're they want to experiment, so let them do it.
Mm.
But there has to be certain guardrails, right? I mean, you need to basically have some governance over there. You must go through some kind of a checklist so that what it can be acceptable in a corporate environment, if I may put it that way. Yeah. It cannot be without any governance. It should not be, because that in the long run will be more troublesome for the organization. So we should welcome it. In fact, the IT function also should make use of it, because it will speed up the the change that may be required as well.
Sir, how has the role of IT function had changed over a period of time? Like, if you
I
could.
mean, over a period of time, I would just simply put it that I used to call myself also Spider-Man, or and so on, because I used to live in the caves.
Yes.
Nobody knew where the IT function was, and what they were doing. Only in case of crisis they were called in, and so on. Heads and whatever. But the change that has changed quite a bit now. Wiser institutions have brought IT functions right into the boardroom, because they understand that IT is not simply enabler; it's a force multiplier. The entire strategy kind of revolves around IT. I mean, you look at it. There are corporations. They may call themselves a transportation company. They may call themselves financial company. They may call themselves in the food business, whatever you may call it. But actually, they're technology companies.
Yes.
It's just they happen to be in that business, and but they are leveraging their entire business is based on technology. So it has changed a lot. Now, of course, like I said, the change has primarily been, on the more, institutions that are more wiser, more, bigger, more, the thought process is a little bit more further out there. But, I think the change is quite visible, that, every other institution is understanding the significance of information technologies, solutions bring to table. And, willingly or grudgingly, they will have to bring us to the center stage anyway.
And now, sir, coming to your, since you are a board certified independent director as well,
Okay.
so would also like to, kind of understand from you that what role does a board basically plays while guiding technology investments and managing digital risks?
Yeah. See, board is not bothered about choosing an ERP system or a HIS system, whatever. Board's primary goal, in my mind, is they set a vision, they set a strategy, they look at the risks, they are answerable to their stakeholders, that they run a profitable business, right? So, board is essentially to empower, from that perspective. If we choose one solution, for example, board has the right to ask, okay, how will it impact my business? Okay. Will it bring in, more revenues, more patient footfalls? Will the readmission, rate, like in hospitals, will it change, come down? They don't want that, right? I mean, so on and so forth. So the boards, that's one of the biggest responsibilities of the board. Likewise, board should help and take lead in providing the right set of experts in the field of technology in their institutions. CISOs, CIOs, data officers, and so on and so forth, and the hierarchy below that. Okay. Because technology doesn't do anything much by itself. It's the people who need to run it also, and the skill set that are needed is definitely something that the board can push and enable. And I mean, thirdly, what I would simply say also is that with the vision and the strategy, they will also help in the change management process, because things need to, one cannot be still, one has to change, and then foster a collaborative environment and make that change happen. So broadly speaking, I'll put these are the three main goals, with the risk appetite that they have, get these things enabled for the institutions.
Right, sir. And one of the things is that is this ESG reporting and governance tools. So, there are a lot of platforms that I've developed, which are automating this entire compliance thing, ESG related.
Yes.
What are your views on those digital platforms, sir? Like,
See, yeah. Firstly, ESG is still evolving in India. It's not there yet. I mean, things can change, soon. There is a mandate for some, I mean, top of the
especially,
pyramid, yeah. So they are there. See, ESG primarily has been like a tick, tick, tick.
yes,
Okay, like a checkbox kind of annual event, so to speak. Put it in the annual report and so on and so forth. What you've achieved, things like that, right? And but I think with digital tools interventions, what we can do is, there will be more transparency, which is real time. Compliance, could be better, because you will, digital tools will also basically look at or bring about AI applications that will analyze things and basically bring things to the fore, so to speak. I see digital tools making it ESG 365-day process, not like now let's just build this thing. Unfortunately, there is greenwashing sometimes,
Yes.
and so the greenwashing piece would probably, be, I mean, there's no need for it. Let's put it this way. Uh, you know, the data collection was not that easy earlier. So then maybe, that's what happened. I think people are committed to it as such when they go there. And so these tools will make it more real time, more transparent, more, in some sense, you can do interventions more quickly because of the AI tools, and so these digital tools will help in that process much more, be open and transparent, and reporting easier.
Yes. And for that, the regulations have to be stronger, sir, because
Of course, I mean, we want to, be more green the way we are. I mean, less energy consumption. The waste management has to be, handled better. I mean, so on and so forth, right? I mean, all of these will become easier to basically manage and report. So all of that is very much important. How you do that.
and now the last part of the podcast, sir, if you look ahead, what is one advice that you'd like to, one or maybe multiple advices that you'd like to give to CIOs and digital leaders on selecting and scaling right technology mix?
Firstly, I mean, I don't get enamored by, cutting edge, bleeding edge buzzwords so fast. Okay, we should not
Right.
be. We should, eventually we'll learn and taste everything that is out in the market. Be patient. We do it for a purpose. You find a solution for a problem you have.
Yes.
You don't implement a solution because you are in love with it. Okay,
Yes.
so just let's be, wary of that. Second thing is, we can buy all the solutions that we have, okay, but without the right people within your team, it will not go anywhere, right? So then we must build a strong team, empowered team, that basically, is necessary to, to actually, get the best out of whatever we are doing. And thirdly, there has to be governance over this. I mean, you need to have a data stewardship. How do you handle cyber issues? How do you basically extract maximum mileage of what you are doing, so on and so forth. So I think I will break it into three categories. Find solutions to problems, get the right people, and have the governance in place as such, so that you get the maximum out of that by protecting the environment that you so much care about.
Thank you. Thank you so much, Sumit, sir. It was an honor talking to you and extremely grateful that you took out time to share your insights. We'll be in touch, sir. Thank you so much.
Absolutely. It's my pleasure, and look forward to talking to you again soon. Thank you.